My patients often ask me about the commercials on TV if the story is about hypersensitive teeth and teeth that are sensitive to hot or cold substances, and if that's really the right solution. And I counsel them that really it's more complex than that. Why the tooth hurts in the first place is there's inflammation of the nerve inside the tooth. Your tooth, in fact, all 28 of your teeth, if you have 28 teeth, have nerves in them that are called the trigeminal nerve. And what is happening is you're getting a neuritis, that is an inflammation of the nerve. And so you've got to say, why am I getting an inflammation of the nerve? What's causing this? And one major cause that isn't talked about on television is sleep bruxism or sleep grinding. In other words, you grind your teeth at night so hard or clench your teeth so hard that the nerves inside the teeth actually get inflamed. And that grinding actually causes inflammation, and that's what makes the teeth hypersensitive or supersensitive. So it's important, I think, to be looking at all the causes of hypersensitivity. It could be just from having a super acidic diet and you're starting to get minor decay around the necks of all your teeth. But that is not often the case in an adult. Adults have usually decreased their sugar intake. The bottom line, I think, is to look at everything. So come in, have us observe your mouth and see if it's a decay-related problem, an acidity-related problem, or is this secondary to sleep bruxism, and maybe you need a special soft night guard. You never think of sleeping on a rock, and why would you have your teeth bite together and have a very hard tooth-to-tooth experience at nighttime when you can put a pillow on your teeth? So if you want more information, email us info@dolphindentistry.com or phone us 613 to learn more. Call 234 and 5758. Make a smile date.